Heritage Health is North Idaho's largest provider of integrated medical, dental, mental health, behavioral health, and substance use disorder treatment services. We have a dozen locations across the region, including clinics in Coeur d'Alene, Post Falls, Rathdrum, and Kellogg. The mission of Heritage Health is to provide hope, inspire change, and extend life for our patients and the communities we serve.
I've been seeing Dr. Paula for, I want to say like 15 years now. She's really more of a friend than a doctor anymore.
Possibly a lot of people's perception is that it's this welfare, not care, not competent, not professional. And everything I've ever had there has been the exact opposite. From the front staff really having their act together and knowing how to politely and respectfully keep the line moving and act like they really do care, and you can tell they care.
It started one day when I had an appointment with her. I had never met her at my doctor's office. And oh boy, she really went through all my meds and everything. And hey, this lady's pretty nice, you know. She knows how all of this stuff. She's very, very knowledgeable.
Sandy came to see me when her doctor sent me a consult and said, please help Sandy with her medications. Having trouble, you know, remember to take things several times a day and this, that, and the other. So we sat down and talked about what would work best for her, and we switched a bunch of things to once a day and set her up with pill packs and, you know, just spent the time with her that she needed to get the explanation and the help and the, you know, and the support. And she just thought it was just the greatest thing ever.
Because she loves me and she wants what's best for me, and I know that. She wants nothing but the best for me, and she has the knowledge to make that happen with me. And I want to live to be 100. Everybody knows I want to live to be 100. And she's going to help me with that.
Well, I chose clinical pharmacy straight out of school, so I've been doing nothing but clinical pharmacy for 12 years. And it is the most rewarding thing that I can do, because physicians have to, you know, juggle so many balls, keep so many balls in the air, and then I can come in and be a specialist when it comes to medication management. And they give me the time. They give me 60-minute appointments with my patients, which is necessary. A lot of them have 20 meds and they're 83 years old, and they need that extra time and that extra attention to detail. And so I love the fact that I can do that for my patients, and it makes clinical pharmacy, what I'm doing, so rewarding. It's amazing. I love it.
I struggled with drug addiction for over 20 years to every type of drug. My 16-year-old daughter is currently struggling with drug addiction. A lot of my family and friends I know here, it's really hard and really lonely to even be sober because half the people I know use.
If you're at the bottom, find your bottom. Everybody's is different. And it's not the perceptions of the consequences. It's what's going on in your life right now, which can be that bottom, and you need to make a decision. Just about all of my clients are sent here, but through other entities, the courts, and what we call a nudge from the judge. And some of these guys are able to come in here. We can open up their mind that this is my bottom. This is as far as I have to go. I'm willing to do what is necessary. Not say, but willing to do what is necessary.
But now I have 16 months sober. July 7th, 2018 is my sobriety date. So I've been clean and sober, and I mean, I just lost everything. I lost the clothes on my back. I lost my children. I lost every possession I ever owned. And I'm working back up from scratch.
It's just one voice, but it goes on and on, you know, about committing suicide and stuff.
He's one of the strongest people I've known in my life, and that he has overcome so many things, and not just his schizophrenia, but he has other issues that he's had to deal with, and he is a true survivor.
My opinion, I hope I get rid of these voices, you know, but I probably wouldn't know what to do, you know, and like I said, the ACT team, you know, good at doing things, you know. If you're feeling low, when they're there, you can talk to them, you know, about anything, you know. It's a lot better.
I love pediatrics because you get to see this huge range of ages in your practice, and there is just nothing else like that. I mean, you get to watch your patient grow and change before your very eyes, and it's so fun. And the medicine changes with it. You know, taking care of a newborn baby is totally different than taking care of an adolescent, and we get to incorporate all of that into our day, and I just find that really satisfying.
A core part of our mission is to extend life, and when we talk about that, I really want people to understand, you know, why that's a part of our mission, because I see there are so many years that are wasted when people have their lives cut short, whether that's through, you know, a completed suicide, whether that's just through an early death because they didn't manage their care, whatever it is, any death is tragic. And so we want to make sure that patients live that best life possible. And when patients work with us, when they trust us with their care, it allows us to be able to sort of drive their care to a better place.